Next, pag-usapan natin yung pathway or yung process or yung flow sa loob ng theater for non-day case na surgeries. When we say non-day case, ibig sabihin, the patient has to stay in the hospital for more than 24 hours. In the Philippines, bihira ang day cases kasi requirement sa PhilHealth, kailangan magstay sila for 3 days for the surgery para makompensate or para mabigyan sila ng discount. In the UK, syempre, walang PhilHealth. Everybody has an insurance and libre yung expenses, so they don't need to stay for 72 hours. And in my current trust, they have a program of enhanced recovery which actually shortens the patient's stay in the hospital. So, mabilisan. So, common sa amin ang mga day cases or same-day discharge. Anyway, paano ba ang flow? Sa Pilipinas, kung non-day case, ang unang mangyayari is, syempre, merong surgical consult si patient outside the hospital. So, meron siyang check-up with the surgeon, i-explain the surgeon bakit kailangan yung surgery, ano yung mga complications, and ano yung mga possible outcomes. And then, the patient will be admitted in the hospital, the consent will be obtained, and then a pre-assessment by the anesthetist, and if applicable, yung cardio or pulmo to give a CP clearance. Usually, yung anesthesiologist sa Pilipinas, makikita lang niya yung patient kapag na-admit na siya. Kasi hindi naman nagki-clinic ang anesthetist. Before the surgery, there will be a pre-operative checklist. So, ibibigay yung mga pre-op medications, lilinisan yung area, tatanggalin yung buhok-buhok or i-shave yung extra buhok kung kailangan, ganyan. Kadalasan, nag-i-insert ng IV line prior to patient transport. So, before dumadating yung patient namin sa OR, meron na silang mga patent na IV line. So, yun yung ginagawa sa ward. Pagdating ng patient sa OR, syempre, there will be an endorsement between the ward nurse and the circulating nurse. Upon receiving the patient, dadalhin na si patient sa OR table and he will be positioned on the OR table. Yung sign-in component sa surgical safety checklist is not explicit in the Philippines. It is implied. Hindi mo kailangang i-verbalize yung content ng cervical checklist doon sa Pilipinas. So, it's usually the anesthesiologist who asks the questions. Yung circulating naman, nire-review niya yung chart kung kompleto yung mga details na kailangan niya, and then he will simply tick on the surgical safety checklist. Next thing that happens is induction of anesthesia. So, when we say induction, binibigay na yung anesthesia, and si circulating nurse, nandun siya sa tabi ni anesthesiologist to support and to assist the anesthesiologist. During this time, prepare na ni scrub nurse yung back table. So, nilalagay na niya lahat ng kakailanganin niya, lahat ng supplies. I-open na niya yung mga supplies na pwedeng i-open. And then, after that, the circulating nurse is going to prep the skin. Okay? Habang nagpe-prep ng skin si circulating, si scrub naman, nag-i-scrub na. And then, he will be wearing the gown and gloves. Siyempre, nag-i-scrub na rin si surgeon, darating na rin si assistant. So, the scrub nurse is going to serve the gown and the gloves to the surgeon and his assistant. After na-prep na si patient and after na-drape na si patient, we will be doing the initial count of sponges, instruments, and needles. This is done by the circulating nurse and the scrub nurse. Okay? And after the initial count, there will be the surgical timeout. Ang nakakatuwa sa Pilipinas, this is not official in the WHO, but we include a prayer, a short prayer in our surgical timeout. So it's a prayer. Actually, nakalimutan ko na yung prayer. Memorize ko dati, pero ngayon nakalimutan ko na yung prayer. I'm not really a religious person. Come to us now, Lord. Something like that. And the surgery will start, and then throughout the surgery, securing of specimen, second and final count of sponges, instruments, and needles, and then immediate post-op care, yung closing ng suture, this will be left with the assistant surgeon kasi si surgeon mag-scrub out na siya to sign the operative technique. The scrub nurse will be left to do the post-op care. Sometimes the circulating nurse helps with the post-op care kasi si scrub nurse kailangan niyang linisan yung mga instruments niya. And after the post-op care, syempre, the patient will be transferred to the recovery room, and an endorsement will be given by the circulating nurse to the recovery nurse. Now, how do we do it in the UK? Yung pre-assessment ng patient, mas mahaba siya and mas matagal. Kasi dito, dahil libre ang operation, usually patients are scheduled months ahead. So a part of this pre-assessment that they do includes infection risk, mobility assessment, and other checks. Now, pagdating ni patient, pag na-admit na siya sa hospital, there will be further assessments. There will be additional assessments that will be done. And this includes additional risk assessments such as falls, dementia, mental capacity. Mahaba siyang listahan. In my trust, we use a specific perioperative care pathway. Isa siyang compilation ng forms that contains all of the assessments and all of the needed documents related to the patient's surgery. Now, on the day of the surgery, first thing in the morning, there will be a team brief. This is one thing that I appreciate in the NHS. Merong team brief for all theater staff, and there will be another team brief for each theater suite. Yung bawat theater suite may kanya-kanyang surgical teams. So, bawat teams may team brief. Ang nangyayari sa team brief is that magdi-discuss yung surgeon, yung anesthetist, and yung scrub practitioner. Ano yung mga risks na nakikita kay patient, ano yung plan, ano yung technique na gagawin, and everybody has to pay attention para alam nila kung ano yung mga pwede nilang i-expect intraoperatively. So, remember, wala pa yung patient sa theater nito. So, after the team brief, susunduin na yung mga patient. Then they will arrive. Then they will be transported to the theater. Pagdating ni patient, there will be another pre-op assessment that will be done by the anesthetic practitioner and by the anesthetist. Pansinin nyo, ang daming assessment, ang daming pre-op assessment na ginagawa dito sa UK. And then after the pre-op assessment, then after this, the patient will be positioned on the OR table, and before induction of anesthesia, they perform the first step of surgical checklist explicitly. So we have the sign-in period wherein tinatanong yung mga details and kino-confirm yung mga details such as the patient's identity, consent, ano yung area or site of operation, laterality. This is done by the anesthetic practitioner and the scrub practitioner. The anesthetic practitioner asks the questions based on the checklist, and the scrub practitioner confirms it with what he sees with the patient. In the UK, we use multiple forms of patient identification. We ask the patient to state his complete name, date of birth, confirm the NHS number with his ID band. So habang pinoposition si patient, si scrub nurse nag-i-scrub na, or minsan nga naka-scrub na si scrub nurse at this point. Tapos sa circulating, tinutulungan na niya si scrub na mag-open ng mga packs. For orthopedic cases, kasi ang daming instruments, usually maagang nag-scrub si practitioner. So by the time na naka-set up na siya ng sterile field, dun pa lang mag-sign in si anesthetic practitioner. So after the sign in, syempre induction of anesthesia, and then yung surgeon mag-scrub in na rin, and immediately afterwards, skin prep, and then draping ng patient, which is done by the scrub practitioner or sometimes even the surgeon do it. Before incision, there will be surgical timeout. Napansin kong difference is, in the Philippines, it's only the circulating nurse who speaks during the surgical timeout. Tas mag-a-agree lang yung mga members ng team. In my current trust, everybody speaks. Kasi nga naman, you have to introduce yourself and what is your role. Okay, so lahat magsasalita during surgical timeout. The surgical timeout is led by the circulator. So dito, it's more of a question rather than an announcement, and then the questions will be answered by the person responsible for that role or for that task. Yung initial count ng mga instruments dito in my current trust is done once the scrub and the circulator have assembled all the needed supplies. So after the surgical timeout, the surgery commences, and then during this time, they will perform the second and final count. Sa trust namin, they do an extra count at the end. So, 4 yung count. And then, immediate post-op care, and after the patient is extubated or after the patient has been stabilized, before the patient leaves the theater suite, there will be the third component or the third phase of the surgical checklist, which is the sign-out. So, hindi pwedeng lumabas si patient, hindi pwedeng lumabas yung mga members ng theater or ng surgery kung hindi pa nagagawa yung sign-out. Kasi they have to confirm all details and all final check before the patient leaves the suite. Once the sign-out is done, the patient will be transported to the recovery unit and handover will be given to the recovery practitioner. Handover to the recovery is between 3 people: the scrub practitioner, the anesthetist, and the recovery practitioner. In another video, I will discuss the components of the handover as part of our PACU policies and routines. And finally, the setup. So in the Philippines, yung hospital ko, we have one theater suite for neuro surgeries, 1 major, 2 minor suites or minor OR, and then we have 1 laparoscopic room, 1 OB room. Then interestingly enough, we have bronchoscopy room, and and then shockwave room. And we have what we call a central supply room. And finally, within the OR complex, we have a recovery unit which I believe has 8 beds, at least 8 beds. Madaming beds yung recovery namin eh. Now, in my current trust in the UK, we have 4 major theater suites in the main theater. Medyo kalat-kalat yung mga theater. We have main theater where I work. Then we have day theater or day surgery unit, which is 2 floors below. Then we have a gynae theater, which is several meters away. So, kailangan naming maglakad ng pagkalayo-layo. And then we have maternity theater. So, all in all, may 4 na theater sa trust. I work in main theater. So, we have 4 theater suites. Then, we have a 5-bed recovery unit. Yung katumbas ng CSR dito sa UK, we call it a twin bin. Yung mga lalagyan ng gamit are twins. Kasi they always come in pairs. That's why they call it twin bin. Or at least that's how they explain it to me bakit twin bin yung tawag. So, all these suites lie adjacent to one another. The difference between the theater suite dito sa UK and in the Philippines is that sa Pilipinas, pagpasok mo sa OR1 for example, pagpasok mo ng OR1, makikita mo agad yung OR table, tapos yung anesthetic machine, tapos yung mga trays and back table doon sa gilid. Minsan nandun yung C-arm, kung applicable yung C-arm, and yung, kalimutan ko na yung tawag sa board kung saan pinapaskil yung x-ray. So yun, kung ano man yun. And sa OB, syempre makita mo yung port ng oxygen para doon sa baby paglabas niya and suction. Sa UK, the theater suite is composed of 3 rooms. One is the anesthetic room. The other is, nakalimutan ko yung specific na pangalan ng room, pero it looks like an equipment room. It's also the same area where the scrub prepares the equipment. And finally, the main suite. These 3 rooms are separated by doors. So for example, during induction of anesthesia, yung patient nandun sa anesthetic room. Tapos, habang nagpa-prepare ng gamit si scrub, nandun siya sa room niya. So hindi mo pwedeng istorbohin yung, you're not allowed to barge inside the room just because you want to prevent mistakes. Especially sa anesthetics, ayaw nilang naiistorbo sila during induction, cannulation, and everything that they do. Yung scrub, ganun din. You cannot interrupt the scrub and the circulating while they are preparing the equipment and doing the initial count. Sa Pilipinas, you can interrupt whoever you want. Sa Pilipinas, I remember, kahit habang nag-intubate sila, pasok kami ng pasok sa OR kasi we will get these supplies, mag-i-scrub kami, so nakaka-istorbo. Nakaka-istorbo nga naman. So I salute to the anesthesiologists back home in the Philippines. They can work under pressure. Dito sa UK, I think di nila kaya yun. They're sensitive to that. Nagagalit sila kapag bigla-bigla kang pumapasok sa anesthetic room. Okay, so I think napahaba yung video na to. I will be posting another video to share how is it to work in the theater, especially in the recovery unit, since yun yung role ko for now. Thank you for watching, and if you like this video, don't forget to click, like and subscribe, and try to see my other videos as well. See you soon. Bye-bye.